started. We are opening the Growth Summit stage this afternoon with Valentina Milanova, CEO and founder of Daye. Valentina will share her experience about how the gender gap in medicine is placing women and AFAB folks at risk, and the disparities in research funding, clinical trials, and medical product development that have long marginalized the health needs of this demographic. Can I please have a round of applause for Valentina, please?
Hi, everyone. Good afternoon. Thank you so much for joining. What I'm going to talk to you about today is how we can use a very humble and readily available product, the menstrual tampon, to disrupt the state of gynecological care today. But I wanted to start with a bit of history and education on something that you might not be familiar with. So we all have heard about the gender pay gap or the gender gap in household chores. But a much more serious gender gap is the gender gap in healthcare and innovation. So as a result of the fact that women were only allowed to participate in clinical trials in 1993, so less than 30 years ago, the majority of medical devices and pharmaceuticals we have available to us today were never designed for nor tested on the female physiology. So we know very little about how they affect women. And this is actually the case even when we talk about medications that are specifically designed for women. So if we take a look at the female Viagra, ADI, it was safety tested in only 25 patients, and 92% of these patients were men. Period pain is one of the biggest examples of the gender gap in healthcare today. Period pain affects 90% of the female population, yet it is still largely trivialized. We think of it as just something the women have to deal with, they have to grit their teeth through, despite the fact that we know that period cramps can be debilitating and as painful as having a heart attack. Another huge example of the gender gap in healthcare is the gender gap in diagnosis. So across 700 different diseases, including diabetes and cancer, women get diagnosed significantly later than men. And this is really unsurprising when you picture the main tool that people use to diagnose women today. So this is the speculum. And what you can see on the left is the first speculum ever invented, so from Roman times. And what you can see on the right is the speculum as it still is today. So we haven't really seen any tangible product innovation there. Another example of the gender health gap is the over-sexualization of female patients. So what you see on the screen is a peer-reviewed, publicly funded study on endometriosis, which affects 1 in 10 women. What the researchers decided to look at was the perceived attractiveness of women with endometriosis. Obviously, their attractiveness doesn't have any impact on the development of the condition, but this was the conclusion. Women who have endometriosis were perceived to be more attractive based on the criteria of having larger breasts, a leaner silhouette, and having started having sex at an earlier age. So why is this happening? Why do we have this very prevalent gender gap in healthcare? It actually starts really early. So before we select a new medication or a new medical device for human testing, researchers typically conduct animal testing. There's a gender bias even in animal studies. Researchers and scientists prefer to use male mice over female mice out of a worry that the female mice would pollute the quality of clinical research with their menstrual cycles. There's also a huge funding gap, both public and private. And in the US, less than 2% of public funding actually makes its way to the whole of gynecological health research. Another thing that stops gynecological health innovation is the bans that exist today on large advertising platforms like Meta, Amazon, Google. They disallow the mention of anything to do with the vagina, anything to do with the reproductive tract. And this is actually something that my company, Daye, suffers from a lot. So here's one example. This is a video of our flushable tampon wrapper. So nothing adult, nothing too disturbing. It's just a video of the wrapper dissolving in water. Meta initially categorized this as adult content, so in the same category as porn, and later classified it as political content. So what can we do to bridge the gender healthcare gap? We can start by investing significantly more research funding into gynecological health. This is another example of the gap in innovation. 2.5% of public funding goes to the whole of women's health, yet 1 in 3 women will suffer from a chronic reproductive health condition in their lifetime. Another thing that we have to do is we have to back more female founders because they are more likely to work on solutions for women's health and gynecological health. Currently, women receive anywhere between 1 and 2% of venture capital. Another thing that we can do is celebrate the success stories in gynecological health, so I wanted to highlight some of these for you today. Starting with WE, which is an innovative new form of female contraception, which utilizes a non-hormonal suppository, so it goes vaginally, and it thickens the cervical mucus, creating a cervical plug. Another great piece of innovation is ONUT. So this is a solution for painful sex. It's a silicone ring which can be applied on the penis, preventing pain from penetrative vaginal sex. And of course, I have to mention my company, Daye, and what we're doing to bridge the gender gap in healthcare. In this quite grim context, we want to bring forward a brighter and more positive future in gynecological health. And we think that tampons can play a major role in bridging some of the gaps that exist in gynecological health today, starting with menstrual pain relief and expanding to at-home vaginal health diagnostics. So we started with the invention of the world's first pain-relieving tampon, which works through the vaginal mucosa, and it both absorbs your menstrual fluid and at the same time releases a proprietary pain-relieving formulation. Our products are medical devices that have been through multiple rounds of clinical trials. And what happens when you place women at the center of clinical innovation, you create a product that works better for them. So our tampons are safer than painkillers, have fewer side effects, and work faster and for a bigger percentage of the general population. We've also created a 360 approach to tackling period pain with the world's first virtual period pain clinic, which helps people get diagnosed with the root cause of their period pain and then build a personalized pain management plan. Next, we've expanded to another taboo area in gynecological health, vaginal infections. With the same tampon, we can also diagnose STIs, HPV, vaginal infections like thrush and bacterial vaginosis. And this is really important because every woman will experience a vaginal infection in her lifetime. They're incredibly prevalent. So how does the diagnostic tampon work? You insert it in the vaginal canal, you take it out, you place it in a pouch, and then you ship that pouch to one of our lab partners using the postal service. Once you've received your results online, you can also connect with a vetted nurse or an empathetic gynecological health specialist. You can obtain prescription treatments delivered straight to your door. So we provide a closed circle, full-scale gynecological care from diagnosis to treatment. Another thing that we're doing to bridge the gender gap in clinical research is actively investing in clinical trials. We're currently focusing on the relationship between the vaginal microbiome and a number of different important gynecological health conditions such as HPV, menopause, fertility, ectopic pregnancy, and other. We've decided to bring manufacturing of our tampons in-house, which allows us to break a decade-long monopoly in tampon manufacturing, and to also design a tampon that works better. So by bringing manufacturing in-house, we can create a menstrual tampon that's smaller, more absorbent, and more sustainable. And sustainability is at the heart of everything that we do. So we've created the world's first flushable tampon wrapper and the world's first flushable tampon applicator, which allow us to save tons of non-recyclable petrol-derived plastic waste, which would otherwise just end up in oceans. Another way in which we want to make a positive impact in the world is by supporting local communities. So we partner with two very important charities, A21 and Daughters of Bulgaria. They help people who are the subject of human trafficking or sexual trafficking escape the cycle of abuse. And Daye is the industrial partner, which means that we provide employment opportunities in our production facilities to the people who escaped sexual trafficking. So in brief, what we're building is the one-stop shop for all things gynecological health, from your first menstruation through to menopause and beyond. And before I leave you, I have a parting thought, which is that medical equality necessarily starts with language equality. So we have to be more open and more vocal about the realities of gynecological health today. We have to speak up and share our experiences. So I suggest that we start today. If you could please join me on the count of 3 of saying the word vagina. 1, 2, 3, vagina. Thank you so much. Thank you for your time.